Welcome back to Stacy Washington Now. So excited to have joining us today someone who's going to chat with us about a huge problem we're having in our country right now with Dr. Mark Mostert, senior researcher for Able Americans. This is a National Center for Public Policy Research project, just like Project 21. Thank you so much, Doctor, for joining in.
My pleasure. Good to talk with you.
So let's talk about this. We have veterans. We have a lot of homeless veterans. In fact, I think the number that was most recently reported was 55,000 homeless veterans across the country. And then you have illegal aliens, numbering at about 10 million, who are receiving benefits, including, I read a story, doctor, that they're actually reappropriating funds from the Veterans Administration to give medical care to illegal aliens. Tell us what you're finding.
Yeah, this is a very important story. And yes, our veterans deserve the very best that we can give them for the services that they provided to all of us. And basically, what happened was there seemed to be the idea that an accusation, actually, that the Veterans Affairs Administration was actually paying for health care for illegal aliens. The VA denies that. And basically, both are right, both sides are both right and both wrong. In fact, medical care is not being paid for through the VA, but the VA is processing medical claim forms for illegal aliens. So the bottom line is this is an old rule that's been in place since 2010, but the ICE basically, when they apprehend an illegal alien, if there are any medical issues, they will farm that out to the medical provider, and then the claim for that service is run from ICE into an office in the VA. And that's where the problem is. Now, the VA says this is not a big deal. Okay. It's a drop in the bucket, this kind of stuff. But basically, if you look at the numbers, then you get an idea that, yes, indeed, energy, time, and resources are being used within the VA on illegal alien issues. For example, in 2022, this particular office within the VA processed almost 162,000 medical claims for illegal aliens. So the VA is correct. They're not providing medical care, but they are providing services. And so you have this massive amount of money, it's about $94 million for 2022, being spent on processing claims. Now, it's true that ICE reimburses the VA for that. But that still means that there are people within ICE who are working only on processing forms, medical claim forms for illegal aliens. And that obviously takes away from our veterans, and it should be looked into.
Yeah, and so they're saying it's not that big of a deal, but we see a whole of government approach being utilized by the Biden administration where they're taking money from a little here, a little there. They're appropriating money. Actually, I'm not sure how they were able to cobble together $22 billion to pay for resettling migrants across the country, but they did that in years 2021 and 2022. So the reporting comes in little dribbles. It's a drop here, it's a drop there, but the overall expense to the American taxpayer is outstanding. I mean, think about any project that we would undertake in America for 10 million Americans. You would see people in both sides of the political aisle fighting for and against that funding, because if you take 10 million people, any amount of money that goes to every single one of those 10 million is going to be an astronomical sum. And we would be looking at, well, where are we getting that money from? We're already borrowing so much. So what's the answer here? How do we stop the Biden administration from appropriating these funds? I thought the purse strings were controlled by Congress, which is controlled by the GOP right now.
Yeah, I think that's true. And that's why two Republican representatives have brought through an actual act to stop this from happening. They basically don't want this to happen. And not only that is it the resources being used, but get this, okay? In 2021, there was a backlog of 150,000 medical claims for veterans. That jumped in 2023 to almost 420,000 backlog medical claims that have not been attended to. So yeah, I applaud the congressman for bringing forward this bill. It's called the No VA Resources for Illegal Aliens Act. So that will remove this rule that allowed ICE to get the VA to process these claims. That would remove that completely, and it would have to be done somewhere else than in the Veterans Administration. But you're absolutely right. A million here, 94 million there. To us, those are big numbers. When you're in big government and big bureaucracy, $94 million, and this is what the VA is basically saying, is a drop in the bucket. So why should we care? Well, we should care because that $94,000 could be used for veterans, and those people who are processing the 160,000 odd illegal alien claims could be processing VA claims from veterans to get rid of their $400,000 odd thousand backlog. So it cascades, right? You have a good idea that someone thinks a good idea, you throw money at it, and then you hope nobody finds out that you're throwing money at it. And this has been found out since 2010. This has been happening, and it needs to stop. So if this act goes through, I think that would be a great thing. Is there going to be opposition to it? Absolutely. As we know, with everything that the Biden administration does, they stonewall, they stymie, they tell us there's no border problem. This is not good for the country, and it's certainly not good for veterans.
It reminds me of the 387,000 veterans who died waiting for an appointment. When that story broke during the Obama administration, everyone was, on the left, they were saying, well, you don't know that they waited dying for an appointment. This is a right wing talking point, but they couldn't refute the numbers. They couldn't deny the reporting. And it was a real outcry from Americans who were saying, why would it take so long for a veteran to get an appointment with the VA? Now, there are a lot of things that go on. People don't return phone calls. People aren't available when the appointments are available. I mean, let's face it, human beings are going to be human beings. But 387,000 people dying before they get seen by a physician, instead of being referred out, instead of having a emergency clinic where they just bring people in and at least address their immediate concerns. It was astounding, and this story reminds me of that one, Dr. Mostert. I feel like there's a huge gaping hole where there should be services. Tell us how to find out more about Able Americans and your work at National Center.
Yeah, thank you. The easiest way is to go to the National Center site. It's nationalcenter.org, all lowercase. And Able Americans is a program within the National Center where we are looking at, does big government work for people with disabilities? Well, as you already know what the answer is to that, just the same as with veterans. But nationalcenter.org, Able Americans is the disability program. We're just up and running. But bringing stories like this to people like your audience, I think, is very, very important, so that they have some in some kind of say in how their government spends money on their veterans.
Absolutely. We will find out more. Nationalcenter.org is the website where you can find Free Enterprise Project. You can find Project 21 and Able Americans Project. So glad to have you here today, Dr. Mostert. We'll talk again. Have a wonderful afternoon.
My pleasure. Thank you so much.